We're recording. All right. Hi, everyone. So, my name is Khaula, and I am here today with a doctor. And she is a resident in training right now in medicine. She's working at Shifa Hospital right now, and very excited to talk to her today. She's also a friend. We've had conversations around mental health before. So I'm glad that we have somebody from the medical profession to reflect on it and to talk about it. So I actually, Mahnoor, feel free to introduce yourself as well and your profession and where you're coming from, and also like let's talk about. I want to dive into why is integrating mental health support in hospitals important. Why do you think that is important, and do you actually think that's important? And if you do, why should mental health support be integrated in hospitals?
Hello, Hola. Thank you for having me over. And it's been like I was actually absolutely excited when I knew we were going to talk about mental health because a lot of it goes unnoticed. First of all, starting with introducing myself, I am Dr. Mahnoor Abbasi. I'm working as a resident medicine in Shifa International Hospital, and today we are basically here to talk casually a little bit about the mental health issues and the taboo around it. How is it related to the physical health as well? So starting with the question that you've put forward, it's so important. In fact, I feel like hospitals in Pakistan don't really acknowledge the need and the dire need, in fact, of this issue being addressed, because they're even in Shifa we have a psychology department which is like totally aloof from the building is even separate from the basic building, and the program needs a lot of I mean it should be there's a lot of work that needs to go into it. As I personally feel like physical health is related to mental health in many ways. A compromised psychological health will lead to a compromised physical health, and a compromised physical health will lead to a compromised psychological health, and it's very much there. The two phenomena are very much intertwined. um, the new concept in medicine is of biopsycho social model, where we are actually digging into these things, where a patient, when we see a patient, we don't really see the symptoms or the signs. We also try to dig in when we are digging in the history. We do try to dig in the psychological factors as well, because some most of the cases that we see, the origin actually starts from a psychological perspective, and then they end up being physically compromised. Um, per se, for example, take an example of a patient who's a diabetic, who has any health condition, who is hypertensive, who's diabetic, who or any metabolic, any cycle that falls into metabolic syndrome. He is obese. They eventually lead to stress, and they also stem from stress. When a major factor, type A personalities, major factor that we see in the patients who are diabetic or hypertensive, they have a stressed life patterns. They have and today we also see that patients with depression or anxiety, your BP shoots up when you're anxious about anything. Your heart rate goes up when you're having generalized anxiety disorder. So definitely all of these things do affect your physical health, and then whichever institution is addressing your physical health should be addressing your psychological health likewise, because I think both have the same origin, and you have to dig into why people have these issues. Yes.
Yeah. Dr. Gabor Mante says something about this, and I think I was having a live talk with another guest the other day, and she said that most autoimmune diseases, 70% of the times, women get diagnosed with autoimmune diseases because of stress, because of mental torture, because of a lot of distressing factors that first and foremost come into them mentally, and then that they become a more physiological symptom, and then so they come forth like that, and then so I think yeah, absolutely. It is very important to have these conversations, especially in the medical profession right now, because hospitals are the places where you have the patient inflow is huge. as I'm assuming, right? In For instance, I do think that when it comes to psychiatry, before we had this trend that okay, if you have a mental health problem, go to a psychiatrist. But then over the years, people understood no, there needs to be a certain time, energy should be given to counseling professions within
Totally.
psychiatry or within the realm of psychology, because at the end of the day, not everything can be, and I'm certainly not like denoting medication or the role of good medication plays in healing somebody, but I'm definitely saying that sometimes, many times, that is
Hmm.
not enough. You have
Totally.
to come and look at the person from a more holistic point of view. And also, I think doctors, just generally, whatever they're specializing in, whatever they're doing, there needs to be that element of, and I'm sure in training as well, the schools do introduce this aspect. How are you engaging with your patient? How are you, are they trusting you enough? I mean, that is why I wanted you to speak today, is highlight if doctors right now are maybe practicing those certain ways of getting to know their patient, or to find out what actually is the stressor behind their ailment or behind their disease. I mean, yes, of course, I am definitely not saying that medication or treatment is not important, but do doctors right now also work on their people skills or their human to human interaction skill, and find out if maybe this person also, apart from medication, needs a crying shoulder or a listening ear? And yeah, I'm not saying that they need to be specialized in this, absolutely, but there, how do you see in your profession usually doctors interacting with their patients?
All right. A very good question again. I feel like even when we are studying in medical school, we have the subject called behavioral sciences, and probably third year, fourth year around these years. So there's this one subject whose marks are not really counted in the prof section, but then they make us study that subject because that subject is very targeted towards how you have to deal with the patients, and how, like, the proper, the decorum of a doctor, and how you have to interact with the patient, and how you have to take care of the confidentiality, and take care of their perspective, how to break bad news. There's a holistic approach to that as well. But when it comes to practical side, unfortunately, or fortunately, Pakistan is a country where we have like very less employed doctors, and as compared to that, the patient burden is huge. We don't really have time for all of that. Like, if I am interacting with my patient one on one, I won't find time to really counsel them in detail. Moreover, I worked in government setups. Hola, I'm working currently in a private setup. I feel like in government setup, it's absolutely no, you cannot interact with patients on a personal level, or you cannot be a listening ear, because obviously the load is too much. And then the illiteracy and the kind of environment that has been created in the government setups in Pakistan is is an aura that does not really allow to cultivate a good psychological health. No. Or in a hospital level, no. But when I talk about private organizations, I do feel like there is a little window where we do try to dig in more into their introspective life perspective, so that we do know where they are coming from, and we treat the ailments better. Because a lot of times, you have seen, I don't know, we as doctors have seen in OPD that there are women who come with issues like हमें यहाँ भी दर्द है, हमें वहाँ भी दर्द है, यहाँ से भी दर्द है, वहाँ से भी दर्द है. But when we go through the tests, there's absolutely nothing that we find. Their labs are fine, their radiographs are fine, their all the workup that we do is absolutely fine, but the pain doesn't go away. And then you sort of think that where is it coming from? There is a strata in Pakistan that directly jumps to Jannat. There's a strata that directly jumps to Jadoo when it comes to
Yeah,
this. But then
supernatural
there's a
and
psychological
black
thing that
magic.
also comes into,
I
yeah.
think it's called Munchausen syndrome, right? Where patients come in looking for medication, or they think that there's something wrong with them. They have somatic pains all over their body. Could that also be because of Munchausen? Like, is that something that I think so. But anyway, yeah, you're absolutely right that there needs to be. Also, I want to know. Um, this is when kids usually come to, or when kids are admitted in hospitals, and is there a safeguarding method in place? Because let's say UK, US, I mean US also has a very bad health system right now, not to, they are very overcrowded, and it's difficult to get that kind of care. So I understand that, but what impact does this kind of medical system have on a child who maybe has PTSD or who's going through something very serious, right? How do doctors generally deal with these kids?
Kala, in my personal experience, I haven't really worked in peds. Not during my house job, not during my training. Like I've never worked in peds department exactly.
Right.
But what I can tell you from afar is that no, there isn't much work being done about children's psychological health. I think there is. Then again, there's a separate department that is dedicated to that. But no, it's not really. I don't think it is very inclusive. The physical health system is very inclusive of that.
Yeah.
But then again, for as you said, PTSD. I was actually talking to someone I know recently about PTSD in children, especially little girls in Pakistan. Are surprisingly or ironically, we have seen that around like 2 or 5 girls undergo sexual harassment during early stages of their life, and then the PTSD that causes them or any kind of child abuse that they see during early years of their life, that does linger on for a very long time. And then one day when they wake up on the wrong side of the bed, obviously things don't turn out really well for them. So I think it is a very I think the whole mental health issue as a whole is a taboo in Pakistan. We cannot get over the fact that it's not being it's
Breast
not
enough.
something that needs to be addressed. I think it's a taboo still, despite all the awareness campaigns, despite all the social media platforms. I think it's still a taboo, and nobody's willing to talk about it as much as it should be talked about. So
Especially in the medical profession, especially
especially,
with, yeah. I feel like, because when it comes to counseling and psychotherapy, people have to actively look for counselors because they recognize, okay, these are my needs and I need. But when it comes to the medical profession, which is basically the root of where science and all that it is being implemented and it's coming from, and
it's actually
those
very
people
interesting,
not.
Khala. Sorry, I'm cutting you, but people usually don't go to psychiatrists that easily, but they do go to doctors very easily. Psychiatrists or psychologists slash, because I personally, I don't know, I think it should be censored because a lot of my colleagues will be offended, but I
No,
think
absolutely.
psychologists are doing a much better job than psychiatrists, because prescribing medication is not the sole solution to it, as you said earlier. I feel like people need to be heard more. People need to be encouraged in a sense that they should know where whatever they're saying is being addressed somewhere, and how to like being, you know a lot of things can be sorted out through talking only. So when we are prescribing, like pharmacologically speaking, the biggest group of drugs that we have in pharmacology is SSRIs. You would know about them, but they're least studied. So psychiatrists, most of the psychiatrists are prescribing them. So what's the point when the whole drug group is studied very less, and they're not really like given implications of that? So why are you, instead of that, I think psychology therapy should be encouraged, and the taboo around should be removed.
Yeah, absolutely. Especially for the sake of kids who are coming in and they display signs of trauma, and the practitioner not knowing what to do about it. And even if they do recognize the signs or symptomology and how the child is in distress, and not being able to refer that child or the family to the right places to seek out help. I think the
Well, I have
medical
you noticed
profession.
in the last few decades, we are seeing very young. We are seeing a rise in young deaths. We are seeing people dying early. We are seeing people being traumatized, like talking about mental health very early, because I feel like there's a whole generation that has been traumatized, and now they know how to speak about it. Um, we were recently talking that there is also probably there's social status symbol, something like that around it, where people say we are depressed, we have anxiety, we have schizophrenia. I mean, kids are really talking about these in schools
Self-diagnosing.
as a culture, you know, as a
Yeah.
yeah. So I feel like that also needs to be addressed. That's not a joke, and it should not be like, it should not be taken that normally as well. I mean, you should have a clear boundary of what constitutes mental health illness and what doesn't. So
But
yeah.
you're absolutely right. But the strata of class, let's look at our social society as a class based system, as it normally it is. The strata of class that is self-diagnosing themselves and self-medicating themselves is still very less to the strata of the society that neglects and taboos this whole thing altogether.
I agree.
So I
Totally.
think that also needs to be taken into account.
Hmm.
But you're absolutely right. I think medical profession in itself needs to. Okay, what do you suggest? How do we revamp the mental health system? How do we, because you're absolutely right that either help is not getting to the right people, or people who don't need that kind of help are making taking pop psychology, self-diagnosing themselves.
Hmm.
What do you suggest? What should be done? What can be done to kind of revamp the medicine system, the medical system? Yeah.
All right. So I feel like, I personally feel like, mental health illness is, when do we call a person dead? In medicine, we call a person dead when he's brain dead. So we have to check their pupils, they're fixed dilated. We have to do the cold caloric test, and we say they're dead when their brain is dead. So brain is a part of your body, your physical body, as we call it, a very important part of it. It has neurological function that drives your emotions. It has neuroendocrine functions that drives your emotions and psychological health. So yes, it is like, you cannot ignore the fact that your mental health is directly related to your physical health, and vice versa. So yes, institutions and hospitals, especially where they're treating physical health, they should take into account the psychological perspective of it. I feel like it's a very far-fetched idea, but all the physicians should also get a training in psychological health as well. I feel like we are not trained that well
Hmm.
for the field. I mean, we are too overburdened. Like, it's very easy to say, just pick a symptom and just diagnose it right there and then, how it's written in the books, and just prescribe medication. It's very easy doing that to do that. Like, if a person is coming to me, if a woman is coming to me with headache, who has PTSD probably going on for years, and I just prescribe her a Panadol or paracetamol, saying that A will give results, which are going to be B according to the book. But then her pain doesn't go away, and she comes again with the same symptoms. So this is going to cause frustration in the medical field as well, and among the patients as well. कि यार ये डॉक्टर मुझे ठीक ही नहीं कर पा रहा, और डॉक्टर कहेगा ये मरीज ठीक ही नहीं होता. So the lacking thing, I feel like, there is a psychological perspective to it. But then again, I feel like, probably, if we do understand that we are overworked, we doctors in Pakistan are overworked, we
And
are
underpaid,
underpaid,
as I like to
we are
say.
overworked, we are unemployed, we are, uh, you name it, and we are under distress. We also, oh yes, this also stems me to a point where, most of our own residents in Shifa right now are seeking therapy, because it does take a toll on our own mental health sometimes. So we don't really have the kind of empathy to really deal with it on one-on-one basis. But what we can do is, in OPDs, where consultants sit, we can have a small arrangement of a psychological therapy area where, patients can be talked through, or the consultant or the physician or the attending can send the patient to that counselor, where, she can or
Yeah,
he can get a little bit counseled about the situation, or realize that they are going through mental issues and they need to be
yeah,
addressed, or
absolutely.
they can be referred to a higher up in
Yeah,
psychiatry, maybe, or
yeah,
wherever.
yeah.
But that
Healthcare
needs to be
professionals.
diagnosed on an OPD basis. Yeah.
Yeah, healthcare professionals need regulating of their own mental health as well in
They
order
do.
to, yeah, absolutely. In order to identify, in order to give that kind of care to their own patients, and I'm absolutely on board with you on that. I think that is but I also feel like that is something that every organization in a society needs to look into. What, especially people in the medical care profession. But absolutely. But yeah, thank you so much, Mahnoor, for this very quick and very short, talk.
You.
I did want somebody from the medical profession. I would have had my sister talk as well, but as always, she's like super busy, and I understand how overworked most of you are.
Yeah.
So I really appreciate you speaking and talking to us, and I
Thank you,
really
Khaula.
hope that with time we're able to at least, at the very least, have conversations around, what kind of patients come for help. And because I also, the brief time that I interned in the Armed Forces Institute of Medical Health, we saw people get ECTs, electroshock therapies, and as a means of, as a viable treatment for their depression or any other kind of psychosis based uh, condition that they were facing. And and ECTs are not exactly a good treatment model to follow anymore. It's obsolete, it's old, it's not viable for so many people, and yet it's still being practiced in our society. And just not our society, but just generally, I think South Asian, East Asian hospitals and medical system still encourages that form of treatment. So we, at the very least, we need to have good conversations around what are we doing in our medical health profession uh, to take care of the mental health of our practitioners, the doctors and nurses that we have, and then what are we doing? How are we equipping these doctors and nurses to give that mental health care to their patients in return? That one.
Also feel like when we're talking about these issues, I also feel like there's one more issue that needs to be addressed, that we are sitting right now, like if we are in the center of Pakistan capital, sitting in our dining room, very cozy, working in private setups, which is very convenient. But when I worked in government setups, scholar, I feel like people, women especially in lower strata, or women from lower background, need to be lifted up, and they, all the counseling or psychotherapies that are available in Pakistan today are so expensive. Even the online ones, or wherever you go, they charge you so much for it. So what about the people who cannot afford therapy, and they cannot even diagnose themselves, what about them? So also when we're talking about this, then I think it should lead us somewhere there as well.
Yeah, there's actually, I looked this up. The government has very recently started providing free of cost therapies as well for people.
Oh.
However, the my problem with that, I think Asma Hamayu is, she's the one. She has brought this MHP SSS system for the people, and they have an app and they train the psychologists, whatnot. But I have a big problem with their system. They have a good system in place, but the psychologists that go to Pakistani universities, unfortunately, are not all of them. And this is not me, taking my wrath out on the education system of Pakistan. I do, however, think it lacks a lot when it comes to training their psychologists and psychiatrists and counselors, especially. We do not have the proper expertise in this area, at least in Pakistan. So I do suggest anyone who is in this profession or who's thinking of remaining in this profession, go abroad for your training and for your degree, because unfortunately, a lot of health systems over here that are being introduced by the government as well are introducing counselors and therapists and psychologists who are not at all equipped with how to handle many of the cases that come up. So I do think that
I
we
agree.
need better people in the field as well, who don't re-traumatize their patients or their clients, and who are able to give the best possible care to these people. So that's something. Yeah. But thank you so much,
I totally
Mahnoor, for
agree.
your
Totally
time,
agree.
and definitely take care of yourself. This was it was
Khaula.
lovely talking.
Thank you.